Caesarean section. It is the incision that is made in abdomen. Caesarean section is an operative procedure whereby the fetus after the end of 28 weeks are delivered through an incision on the abdominal and uterine walls. Caesarean section में क्या होता है कि एक सर्जिकल प्रोसीजर है जिसमें कि हम लोग जो डिलीवरी करते हैं बेबी की उसमें जो है हम लोग इंसिजन या एब्डोमिनल वॉल एंड यूट्राइन वॉल में हम लोग कट या इंसिजन लगाकर तब डिलीवरी प्रोसीड करते हैं. If the first operation is performed on a patient, it is referred to as a primary caesarean section. And when the operation is performed in subsequent pregnancies, then it is called the repeat caesarean section. So, the definition of caesarean section is, it is an operative procedure whereby the fetuses after the end of the 28th weeks are delivered through an incision made on the abdominal and uterine walls. Coming to the incidence rate, during the last decade, there has been 2 to 3-fold rise in the incidence from the initial rate of about 10%. So we have seen the incident rate is steadily rising and caesarean sections are increasing day by day. Indications, there are two types of indications. One is absolute and the second is relative. Some absolute indications are vaginal delivery is not possible. If there is any reason due to some complications, there may be chances that vaginal delivery might not be possible. So one has to go through caesarean section. Next, central placenta previa. Then, if the mother is having contracted pelvis or cephalopelvic disproportion. Next, pelvic mass causing any kind of obstruction. If there is any pelvic mass which is causing an obstruction or blockage, then there might be chance that you have to go through the caesarean section. Then, advanced carcinoma of cervix and vaginal obstruction. So coming to the relative indications, it might be cephalopelvic disproportion, previous caesarean delivery, non-reassuring fetal heart rate, dystocia, antepartum hemorrhage, malpresentation, failed induction of labor, bad obstetric history like she has already went through recurrent fetal loss in the past years. Then it could be hypertensive disorders such as eclampsia, preeclampsia, and medical and gynecological disorders. These were some absolute and relative indications. Coming to the contraindications, first contraindication that is shown in the picture is if the mother is having any kind of infection or sepsis in the abdomen, then it is not indicated or contraindicated. Secondly, if the fetus is dead. And lastly, if the mother is having DIC. DIC stands for disseminated intravascular coagulopathy. So these are some of the contraindications. Now coming to the time of operation, it might be an emergency caesarean section or elective caesarean section. From the name itself, you could all understand the emergency one is to be done due to an acute obstetrical emergency. If any kind of emergency occurs, like for example fetal distress, then this operation may be performed. A time interval of 30 minutes between the decision and delivery is taken as reasonable. Next one is elective. Elective one is pre-arranged or pre-planned time during pregnancy. The operation is done at pre-arranged time. Okay. So next we will see the emergency categories. Emergency categories are divided into 4, 1, 2, 3 and 4. First one, immediate threat to the life of the woman or the fetus. Decision delivery should be within 30 minutes. Secondly, maternal or fetal compromise which is not immediately life-threatening. Caesarean section should be done within 75 minutes of making decision. Third, there is no maternal or fetal compromise but needs early delivery. Last one, Delivery is planned to suit the woman, family members, and the hospital staff. So there are basically four emergency categories: one, two, three, and four. Now we will see the types of operation. First one is lower segment cesarean section. Sorry, by mistake in the slide it is written wrong. It is lower segment cesarean section. In this operation, the extraction of the baby is done through an incision made in the lower segment through a transperitoneal approach, as from the name lower segment cesarean section. Next is classical caesarean section. The baby is extracted through an incision made in the upper segment of the uterus. Uterine incisions for caesarean section, like the cut or incision could be made depending upon the condition. First one is lower segment transverse. In this, it helps to minimize the blood loss and it is very easy to repair. Next one is lower segment vertical. In this, vertical incision is made and it is very easy to perform. Next is J-shaped incision. J incision is mainly used in the case of placenta previa. Next is classical incision. Classical incision is used in case of implantation of placenta previa on the lower anterior uterine wall. And the last one is inverted T incision. Safer technique for mother and child in a scarred lower uterine segment. Like I have already told, if there is repeated cesarean section, then you could use this type of incision. Now we will discuss the preparation of mother before cesarean section. First of all, you have to look forward into psychological support and also the physical preparation. In psychological support, you have to give all the detailed explanations and reassurance, all the information about the labor, information of all the stages, informed written permission for the procedure, anesthesia, and blood transfusion is to be obtained. Next, physical preparation, you have to give intravenous infusion, and next, you have to also scrub with the help of a soap or non organic iodide lotion. The abdomen is to be scrubbed. Next, non-particulate antacid 30 ml or zero point 0.3 molar sodium citrate is given orally. You could also give 150 mg Rantadine, which is given orally at night before elective procedure, and it is repeated 50 mg IM or IV 1 hour before the surgery so as to raise the gastric pH and also to prevent from any kind of aspiration or acid aspiration. Next, the stomach should be emptied and metoclopramide 10 mg IV is given to increase the tone of the lower esophageal sphincter as well as to reduce the stomach contents. The bladder should be emptied by a Foley's catheter. Fetal heart sound and fetal heart rate should be checked once more at this stage. Then antibiotic prophylaxis. Prophylactic antibiotics should be given intravenously before making the skin incision. And note down, drugs which are unsafe or which are not safe during pregnancy should not be preferred or should not be given. Next, we will talk about the procedure in the cesarean section. First of all, IV cannulation, so as to give solution like Ringer lactate solution 5% dextrose. Next, position of the patient. The patient is placed in the dorsal recumbent position. Then you have to give anesthesia. The anesthesia which may be given could be spinal, epidural, or general. Antiseptic painting is done. The abdomen is painted with the 7.5% povidone iodine solution or Savlon lotion. You can also use betadine and it is to be properly draped with the sterile towels. Incision on the abdomen is made. Then packing. The peritoneal cavity is now packed off using two taped large swabs. Then the delivery of the head, delivery of the trunk, removal of the placenta and membranes, and suture of the uterine wound. This is the overall procedure in short. With the help of the picture you could see, I have shown, first one is showing packing gauge around the uterus, second one is incision the uterus, third one is extending the incision downward, then delivering the baby, then scraping off the membranes of the uterus and clearly removing the placenta and the membranes, and at the last proper suturing and closing of the uterus is done. There is a video on anatomy of a cesarean section, or the layers which are cut in the surgery. Post-operative care. In the first 24 hours or day 0, proper observations for the first 6 to 8 hours is very important. Periodic checkup, fluid, sodium chloride, ringer lactate, blood transfusion is done if required. Oxytocin is to be given. Prophylactic antibiotics like cephalosporins, metronidazole for all the cesarean deliveries, analgesics so as to relieve from pain, and ambulation or early ambulation is considered. Baby is put to the breast for feeding after 3 to 4 hours when mother is stable and relieved of pain. In the day 1, oral feeding in the form of the plain or electrolyte water or raw tea may be given. Active bowel sounds are also observed. In the day 2, light solid diet of the patient's choice is given. Bowel care, 3 to 4 teaspoons of lactulose is given at bedtime. In the day 5 or 6, the abdominal skin stitches are to be removed. On day 5, discharge. The patient is discharged on the day following the removal of the stitches if otherwise fit. Then, the cesarean section recovery tips are like you could follow the drugs advised by the doctors. You have to take the proper sleep, the proper sutures, the lining of the surgical incision should be properly assessed. You should take proper rest. You should eat properly. You should drink good water, good amount of water, and you should wear proper clothes. Next, we will talk about complications. The complications could be maternal and fetal. In the maternal complication, it could be intraoperative or postoperative. First of all, we will discuss the intraoperative procedure. It could be uterine lacerations, it could be bladder injury during the procedure, it could be urethral injury during the procedure, and it could be hemorrhage. In the postoperative complications, it could be postpartum hemorrhage, shock, infection, intestinal obstruction, and wound complications. In the fetal complications, it could be respiratory distress syndrome, asphyxia, infection, shock, or intracranial hemorrhage. So, you have to prevent those complications by managing it properly. Or during the management period, you have to look to all the signs and symptoms properly. Now, if you have any questions or doubts, you could just comment down below. And at the end, I have given 3 questions. If you know the answers, you could comment down below after seeing this video. I hope this video is informative to all of you. Thank you so much. And please subscribe if you haven't subscribed yet.